The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
It is truly a medical paradox. Even though we understand more about asthma, even though there are more treatments now available for the condition, since 1980, asthma rates have risen 75%. And among very young children, rates have risen 160% in the last 2 decades. Asthma and allergy are often two issues that go hand in hand together, with over 60% of individuals who have asthma also having other allergic phenomena. I'm Dr. David DeRose, welcoming you to Wonderfully Made. We're going to be probing some interesting insights into allergies and asthma, and to help me in the process is Dr. Teresa Sherrard and Dr. Tim Arnott. Good to have you both with us today.
Thank you.
Allergies and asthma, I mean, how many patients does it seem that come through your office with one set of problems and end up having significant problems with allergies? I mean, I doubt either one of you has done a survey, have you, on your patients?
I haven't, no.
But pretty common, isn't it?
It is a very common problem, especially with admissions to the emergency room in the wintertime. People have a lot of exacerbations of asthma in the winter.
So we've got these conditions, allergy and asthma, and the experts are in some respects throwing their hands up. They're saying, why do we have this growing problem in our country when it seems like we're understanding more? I mean, there are new medications out that seem to be effective. What's the problem, Dr. Arnott? What kind of concerns are there out there? What may be causing or triggering these problems?
Well, I think one of the things that we have to keep in mind is that in this country, we are inundated with a lot of foods that are high in fat, high in sugar, but they're low in nutrient content. And I think one of the examples of a nutrient that's been found to be very important is magnesium. And if you're eating a lot of these processed foods, which is most of the grocery store is processed foods, you're going to be deprived of some of these important nutrients, nutrients that relax the smooth muscle, for example, of the bronchioles.
You know, another big issue has to do with the whole issue of allergy exposure and allergen exposure. It seems that more and more of us are spending more and more time indoors. Our activities have shifted from outdoor activities to indoor things. And where in some cases that may be good or beneficial, it definitely is exposing us to a host of things that we may not have been exposed to in those concentrations in the past. Add to this a number of chemicals that are being linked to asthma. Do either of you doctors have any concerns about the kind of exposures people are getting in their own households when it comes to asthma?
I know a recent article, perhaps a year ago, in the Scientific American journal, actually very poignantly displayed that the real issue with air, impure air and air pollutants is not so much the air we breathe outside the home, but the air we breathe inside the home. That's where the highest concentrations of these toxins are actually, that's where we're exposed to them, inside. And so I think it's important that we actually do some of these things that are simple, again, that can help lower the risk of our exposure to these toxins. One of those things is simply to air out the house, open up the windows, especially during the night, and allow the fresh air to move through the house.
Let's talk about some of these triggers, because people that have asthma may unknowingly be exposed to things in their very home. Dr. Sherrard, what kind of things are triggers for asthma that may be within the very walls of your home, kind of your fortress? You think you're in a safe environment and you've got problems there?
Well, one of the biggest triggers is the little four-footed animals that we like to keep in our houses. Animal dander. That's a big trigger. Cat hair, dog hair.
Now, wait a minute. We're getting onto some dangerous ground here. I mean, everybody loves their pets, and what does someone do if they find out maybe they have allergy testing and they're severely allergic to cats and they've got several in the house? I mean, they're sleeping in their bedroom. What do they do?
Well, you have to weigh the risks of having the animals in the house versus perhaps finding some other way to house the animals. Maybe keeping them in a little cage or a home, a place outside the main area where everybody lives. Because if it's causing a problem with asthma, which for some people can be life-threatening, it may not be a problem that you want to try to contain. And so you'd have to weigh the risk. Is it worth it to keep the animal in the house if it's causing a child or a person to have asthma attacks that could be life-threatening?
Now, Dr. Arnott, I mean, you've heard what Dr. Sherrard said. I mean, think about this, though. This is a member of your family, you know, your pet dog, your pet cat, and what's the big deal with some shortness of breath? I mean, Dr. Sherrard is trying to, you know, use terms like life-threatening. Is she kind of overdoing it?
Well, certainly it's going to be an individual, case-by-case basis, but if there are children in the home and those children are, you know, having to be taken to the emergency department, certainly if there's hospitalizations for asthma that are occurring, you know, if you see a growing problem of asthma and breathing disorders in that family, then that's the family that really needs to take some of these issues seriously. But there may be other ways of dealing with it. I mean, as I understand it, it's the saliva from the cat or the dog that actually causes the problem, so a more frequent washing of that pet may be helpful. A shorter haired pet may be helpful, but if that's not bringing the solution that you need, moving on and moving away from that whole pet situation may be the best.
You know, the other thing that's interesting to me is oftentimes these allergic symptoms, whether it's asthma or other allergies, are the result of cumulative exposures. So although the pet may be part of the problem, if you remove some of these other offending agents in the household environment, the pet may not have enough of an allergic stimulus that you really have problems. So Dr. Sherrard, what are some of those other things we may want to look at maybe before we feel like we've got to part company with one of the family members?
One of the next biggest items is dust, cockroaches, and mold. So to try to eliminate some of the dust in the home, keeping it just cleaned off. Sometimes there are machines that you can get to kind of remove or contain the dust. Airing out the house, as Dr. Arnott spoke about. And mold is another big issue, is trying to contain the mold. Discovering those places in your home that are damp and dark and don't get a lot of sunlight, don't get cleaned out a lot. Taking care of those. And of course, cockroaches, making sure the house is very clean. And like you said, maybe if we can contain some of these other forms of really common allergens, maybe the pet won't cause as much problem.
You know, this whole subject of molds is really a shocking subject. I was listening to a specialist in environmental health speaking at a conference, and he was showing pictures of where mold grows. And mold, you know, we usually think of, well, you know, our house is clean, we don't have any mold growing. Well, one of the things they did is they started pulling wallpaper off of bathrooms. And on the back of this wallpaper, it was loaded with mold. Very common setting for mold. And the bottom line is you may look at your house and things may look great. But some of the recommendations that are being made, if you have problems that are mold related, especially in high moisture environments like the bathroom, wall coverings need a serious look, and wallpaper is probably not the thing that you want in the bathroom.
I think it's also important just to remember that if we provide the body with the nutrition that the Creator designed for it to have, we're going to have a lot less inflammation in our bloodstream. And there's going to be a lot less tendency for this hypersensitivity, this constriction that we see in the bronchial tubes. And I think one of the examples of this, I was at a conference in Orlando, Florida, and met a couple that one of them was experiencing problems with asthma. And then they discovered that meat wasn't the best thing for their diet, and so they moved away from meat, started using more plant foods, and they discovered the asthma problem essentially cleared up. And also they moved away from the dairy products. And there's good evidence that meat actually increases the inflammatory level in the bloodstream. And of course, that blood is also what can irritate the lining of the bronchial tube. So I think some of these nutritional things, if they're in place, there may be less of a problem in general.
Now, this is very important. One of my mentors in my residency in internal medicine drilled the concept into us that the first step in treatment is diagnosis. You know, here we are discussing allergies and asthma, and here you've got three health professionals, three physicians with our training in primary care specialties, and we're talking about a condition that we really haven't explained. You know, we're kind of talking around the issue, but asthma, this condition that we almost take for granted that everyone understands, really has two major components. It has both a component of inflammation that Dr. Arnott was just addressing, but it also has a component of bronchial constriction or airway hyperactivity or hyperresponsiveness. What is that talking about, Dr. Sherrard? When we talk about this airway hyperresponsiveness, how can you explain that in lay terms?
Well, in lay terms, you think about the bronchioles are the tubes that take air down to the lungs, and when there's irritants in those passageways, the bronchioles try to get the irritants out by secreting mucus and try to constrict that airway to try and get some of the mucus out. And hyperresponsiveness just means that the bronchioles produce too much mucus and that they constrict a little bit more than they would normally do for a person that, excuse me, that someone would do that doesn't have that problem. And so as the bronchioles constrict and they produce this excess mucus, you have this plugging that occurs with asthma. People cough and they can't breathe properly because the passages of the tubes that go down to the lung are smaller and the air just can't get down there as easily as it would with someone that doesn't have asthma.
Now, of course, one of the major triggers for this airway irritation is tobacco smoke. Mm-hmm. Dr. Arnott, how do you put that into perspective in this whole dialogue with asthma?
Well, there seems to be a component of asthma if there is an irritating substance that bathes those bronchial tubes, that bathes the airways in your lung, that irritation is actually part of the stimulus for bronchoconstriction, in other words, an increased narrowing of the bronchial tubes. So pure air is very important, and that's why it's so important to keep fresh air in the home, because that's the source of most of our pollutants that we're exposed to.
You know, it's an interesting statistic that some 1/3 of childhood hospitalizations are due for respiratory conditions like asthma, and a major contributor to that is tobacco smoke exposure. One of the interesting studies that recently came out indicated that prenatal exposure to tobacco smoke in the womb, children actually are being primed to respond abnormally. There's effects on the fetus from tobacco smoke exposure. So it's very important information for pregnant individuals and also for individuals with young children. Tobacco smoking really needs to be on the hit list, if you will, as far as getting it out of the home. You know, Dr. Sherrard, you've talked about this before a little bit briefly in some previous programming we've done, but you know, tobacco smoking, I think, is a frustrating habit for many people. By and large, people start smoking before they're aware of all the side effects, then they find they're hooked, and then they feel like they can't stop. And it always seems when we talk about tobacco smoking and its problems, we need to give some hope. I mean, what kind of words of encouragement do you have?
Well, the fact that cigarette smoking can be kicked, even though it's probably one of the most addictive substances in the world, it's possible to stop smoking. There are many programs available through lifestyle centers like Lifestyle Center of America. Many churches have stop smoking programs where they take people through a program where they encourage them to have plant-based diet, where you increase the water that you drink to try and bathe the lungs and the bronchioles and pure water that would help get rid of some of those toxins that are lodged in the deeper parts of the bronchioles, and doing steam treatments to help use every avenue to eliminate nicotine from the system using your skin. It's the biggest organ that we have, and eliminate toxins for the skin. And as well as the spiritual support and emotional support, people go through a lot of emotional issues when they're giving up cigarettes. There are a lot of triggers, a lot of things they worry about that they'll be afraid when they go back into their environment they're under stress. A lot of people smoke because they're stressed out. And so helping people get rid of those problems is a real key issue in overcoming cigarette addictions.
I've seen many people get help with these natural therapies for smoking cessation. There are a variety of drug therapies also that are available, that are commonly used. How do we put that into perspective? I mean, how do you balance, you know, some legitimate concerns people may have? Many of our patients don't want to use drugs, either pills, they don't want to use the patches, but how do you put that in perspective with all the chemicals they're being exposed to with cigarette smoking? Does that seem like clearly the lesser of two evils to you, or is there more concern that we should have about that?
Well, I myself think that probably in the short term, use of medication is not as bad as a long-term use of cigarette smoke, and even using nicotine patches. It may not be the ideal, but if someone feels that this is something that they need to kind of help them over the bridge to get to a point where they can control the cravings for cigarettes, it would be better to do that than to not do anything at all.
I mean, I think that's a good balancing concept, because a lot of people shy away from things that aren't natural, especially people that have the orientation that we often work with in our type of practice. So I think giving that message that the drugs that are available, sure, there are theoretical side effects, there are real side effects that some people have, but if you're smoking cigarettes and you haven't recently tried to quit, even if you have, this is just another reminder to take that step. Dr. Arnott, cigarette smoking also provides a bridge to another condition that surprisingly worsens asthma, and that is something that in medical circles we call GERD. Why don't you share with our viewers what we're talking about when we use this term GERD?
Before we talk about GERD, I just want to make one point about cessation of smoking, and that is that if you're going to quit smoking, it's probably a good idea to also get rid of caffeine, because the use of caffeine can actually encourage the use of smoking. And another substance that you want to stay away from is alcohol, because alcohol has been shown to completely disrupt your willpower. And so I think it's important to remember that removing caffeine and alcohol out of your program is going to be important if you're going to be successful with smoking cessation. Now, GERD simply refers to the gastro-oesophageal reflux disease, which is where we have acid that is supposed to be housed in the stomach moving up into the lower esophagus or food tube where it's not supposed to be.
Now, does smoking interfere with this process as well?
Well, actually, the nicotine that is in the tobacco smoke acts as a dilator of the lower esophageal sphincter. That's a small muscle that actually closes down the lower food tube and prevents the acid from coming up. And the nicotine relaxes that, so it makes it more likely for the acid to creep back up into that lower esophagus. That's important because over time, the cells of the lower esophagus can actually change from nice tall cells to these flat cells that we call Barrett's esophagus. And those who have Barrett's esophagus changes are actually at significantly increased risk of esophageal cancer, which is very serious.
So there's a pre-cancerous condition that's caused by this continual exposure of the esophagus to acid.
And much of this exposure is asymptomatic. You don't realize it's happening. And I think if there's one thing that we could say about removing the heartburn or the reflux, we would say eliminate the supper meal. Eat nothing after 3 p.m. if you're having these kind of problems, because that may be one of the most powerful things that you can do. Also, making sure you don't eat anything between meals can be very important.
Now, the reason for talking about this is not just the link with smoking, but GERD, or gastro-oesophageal reflux disease, heartburn is the common symptom that you feel, is something that's actually been linked to worsening of asthma. There are two ways that GERD can worsen asthma. One is acid itself can come up the swallowing tube and then get into the respiratory tree. But even if the acid doesn't get that high up, as the acid irritates this swallowing tube, it can trigger nerve impulses through something called the vagus nerve that in turn then can worsen your breathing.
I think another point to be made here is that sometimes the common symptom of asthma is not wheezing, but a cough. And one of the other causes of cough is this reflux of acid into the lower esophagus. So that's something to keep in mind. If you're not wheezing but you're coughing, you may have asthma, you may have esophageal reflux.
Esophageal reflux is also worsened by anything that puts more stress, physical stress, in the abdominal area. So if you're wearing tight-fitting clothing, this is generally not a good idea. If you're carrying extra weight around the middle, that too will increase your risk of gastro-oesophageal reflux disease. Now, Dr. Sherrard, there is some interesting research coming out as we're speaking about weight and these issues, about a possible connection with asthma. What's coming out in that line?
Well, it looks as though there is a connection between obesity and asthma. The connection is not perfectly clear, but they've found that obese men and obese women have a higher incidence of asthma. So there's another incentive to try and lose weight, something that we can do to control a problem with our breathing.
So we're talking about a lot of things that on the surface are simple conceptually. They may be difficult to change. I mean, we've talked about exposures in the household, the molds, the animal danders, the toxic chemicals that can be there. I don't know if we've really spoken too much about these volatile organic compounds. I know we haven't used the term in the show. Do either of you have any insights in this whole issue of off-gassing and chemicals in the home?
Well, there's chemical exposures even apparently from the shower. This article in Scientific American actually showed that we can be exposed to chloroform because of the chlorine that's in the water. And so I think it's just so important that we get fresh air into the home. That's important. But one of the other exposures may be in the workplace.
That's important.
To these toxins. And here's an article in the American Family Physician, December 2001, which has a list of different occupations that can be exposed to toxins that can actually increase asthma and incite asthma. For example, we have individuals who are working in the plastic industry or the rubber industry, and they can be exposed to things like toluene. Different refinery workers can be exposed to chromium and some of the heavy metals, textile workers to dyes, plastic and epoxy resin workers to the anhydrides, acrylates for those who are working with adhesives. So if you have an asthma problem, or if you have a chronic cough problem and you're working in industry, you may want to consider some of the exposures that you're experiencing there, and you may want to consider even moving to a different occupational career.
So if that's established that there's some linkage with the exposure. Dr. Sherrard, are there any tip-offs that someone would get that the problem is occupationally related?
Well, you think if you had the problem that during the week and it relented or sort of died down over the weekend or whenever you were off work.
So go on vacation,
if you go on vacation or you're on the weekends, if you're not working and the problem seems to go away, then you might think possibly that it might be related to something at work. And also, if a lot of people that you work with seem to complain of the same problems that they never had before when they come to that job, when they came to that job, that might be a tip-off. But talking to your doctor about what some of the possibilities might be, because he might have more experience with people. Doctors that are working in an occupational medicine sometimes have more of a clue about what's going on in the industry and what new chemicals are out there.
You know, a lot of times when I talk with patients about occupational exposures, they'll say, well, you know, I don't have any occupational exposures. I'm not in manufacturing. I'm not dealing with chemicals. I just sit in an office. And it kind of brings us back to this whole dialogue about these so-called volatile organic compounds. And what we're referring to is the fact that today in building, in decorating, and all kinds of things that we have in our homes and in our offices, what's going on? Well, we've got chemicals that are very unstable, if you will. They're easily evaporating from the shelving units, the particle boards, the carpet. And these chemicals can actually trigger asthmatic or allergic reactions. Now, in the home, Dr. Arnott, you've been making an eloquent appeal that I heartily endorse with keeping air flowing through the home. But, you know, a lot of people in their workplace, they don't have that privilege. I mean, the windows are sealed shut. Or even if they wanted to open the window, you know, they've got coworkers who feel that, you know, they don't want the cold air coming in, or the hot air coming in, or the humid air coming in, or the dry air coming in, or whatever it is. And so this is a real challenge, and it kind of brings us back to this dialogue about sometimes we identify things that are very uncomfortable to identify. How would God lead us to identify a problem in our home or in our workplace that would cause us to have to leave our workplace? I mean, does God sometimes work that way?
Well, I can only tell you my own experience, and I discovered the fact that God can actually make you very uncomfortable in your current job situation because He knows that there's something better for you elsewhere. And so He actually creates discomfort, creates friction to move you out of that place so you can find His special niche where He wants you. So I wouldn't take this as a bad thing necessarily. It may be just in the Lord's order for giving you His full blessing.
I mean, isn't it amazing that sometimes we're praying to God to remove a problem, and instead what He does is He illumines our eyes to some things that seem to be even bigger problems. You know, we need to stop smoking, or we need to change our diet, we need to leave our job. And we're thinking, well, this couldn't be God's will. Lord, why don't you just remove it? And yet He's leading us always to something better. You know, the other issue that I think we'd be negligent not to at least mention are medication therapies for asthma. We've been talking a lot about the environmental things, the natural things that can help, but there are medications that are out there that do help with asthma. Are we saying that under no circumstances people should use these? I mean, what's a balanced approach if someone has bad asthma?
Well, my perspective would be that, you know, move toward a plant-based diet. Move to increase the fresh air in the environment, in the home. And I would also encourage the use of more of these fresh fruits and vegetables and greens, beans, things that are rich in magnesium. These phytochemicals, many of them in the fruits and vegetables, have been shown to be anti-inflammatory, increasing the water, increasing the exercise. If you're doing those things, you may well find that your asthma symptoms improve so much that your need for medication may decrease. But, you know, if you need medications, then you need to work closely with your physician. But certainly you need to remember that the cornerstone of asthma treatment is anti-inflammatories. And you don't want to be using too much of these beta agonists.
These fast-acting
drugs. You want to use those only for emergencies, only for escape out of a difficult breathing situation.
I think that's a very important message. I think all of you can tell that Dr. Sherrard, Dr. Arnott, and I heartily endorse the Lord's remedies for asthma. But untreated asthma or undertreated asthma is life-threatening. We're not encouraging you to throw your drugs and medications away. But as you're using those medications, first of all, make sure you're using them effectively. Talk with your doctors about how to properly use them. And then get on a program that hopefully can decrease or maybe even ultimately eliminate your need for those drugs. It's encouraging to me, the more we learn about how the body works, we see that God has created us with tremendous capacities to cooperate with Him in the healing process.